This is the grave of a young woman whose name was Gloria. It's hard to find even if snow didn't cover the ground. There's no monument, no stone to mark the location or to identify its occupant. Gloria Curtis died obscurely a few weeks ago, and just as obscurely, she was put into a cheap wooden box and buried here in the winter earth. The cost of burying her was $200, paid for from welfare funds. The death certificate said she died of hepatitis, but that's only part of the story. Gloria Curtis was a Chippewa Indian, and like thousands of other Indians, she began to die the moment she left the reservation to come to the city.
I was not acquainted with Gloria, but she was so typical. She is typical of the many people in our community and what they experienced. There was nothing for Native people here in the Twin Cities at all, and no Indian centers, where people could socialize, no schools where people could attend, their children could attend Native schools. It was quite frightening for people to come into the metro area, but they did choose to come because they felt that they wanted a better way of life.
These Indian community workers came to know Gloria during the final few weeks of her life.
With the nurses or the social workers against her, because I got the idea that she didn't trust them. They didn't ever talk nice to her. They just sort of bawled her out every time they talked to her. And she said that there was only 2 of them that were really good to her. The rest acted like they held her in contempt, or they didn't. She said they don't even really want to take care of me, like they don't want to touch me, like I'm poison or something. She said they really treated me horrible.
Gloria's condition worsened, and 2 days later, refusing to go back to the same hospital, she was admitted to a second institution.
When we went in, the admitting clerk, I told her that she was supposed to be admitted and that she had infectious hepatitis. She says, well, she isn't supposed to be here. She's got infectious hepatitis. I said, well, she has to be admitted to the hospital. She's never been here before, and her doctor was supposed to call and make the arrangements. And she checked the files and stuff, and she said, well, he hasn't called and he hasn't made any arrangements, so I don't know what to do. And she called another girl in, and they discussed, what they were going to do. And she said, well, I have to go to lunch. I can't take care of this right now, and there isn't anyone else to take care of it, so you'll have to wait. I said, no, we're not going to wait. She has to be admitted now.
She was so ill, very ill, and didn't seek help until it was probably too late. Our Native people were not going to seek health care until their physical pain was greater than the pain of having to go to that clinic.
But there were no Native doctors or no Native nurses or, staff available for people in any of the communities to be able to see Native people when they came through the doors. It was not a good place to be, and so many people chose not to go there. When Gloria came on about, the importance of looking at health care for Native people, we went around asking stories about people, about their health care, what that meant, why they didn't use Hennepin County Hospital, why they didn't use Abbott Northwestern, on a regular basis. And would they, if there was a clinic or if there was something for Native people? And they said, yes, they would.
We were a committee, okay? There were several of us. There was myself, and there was Charlie Deegan and Norby Blake, I believe, and Hap Holstein. I can't remember everyone, but Chuck Robertson. Many of us back then who got together and decided that something needed to be done about all that.
We were busy from morning to evening. It wasn't unusual for us to sit around tables and develop proposals. And they were so big. I mean, they were like about that thick, about 2 inches thick or so. And you had to have letters of support. You had to have people writing letters, community people, if they could write a letter, and somebody else could type it up for them, and then to have them sign it.
And in that whole process, the Indian Health Board clinic was formed. think it was on Nicollet Avenue, upstairs. We had money to open the clinic, but we didn't have no construction money. So all of us on the board was up there actually doing the carpenter work. We were patching walls, we were putting up the walls and doors and making exam rooms. And of course, later on, they also got more funding through the federal government. Urban health funding in Minneapolis is one of the ones that got funded, and consequently, built the facility they have now.
We always thank the Great Spirit for where we were and how we were able to get where we wanted to go. And so that was important to ask for His blessings and ask for His help.
When I first started here at Indian Health Board in 1997, I was actually the very first Native doctor that provided care here at the Indian Health Board. It's interesting that Minneapolis was actually the very first urban center that recognized amongst its community members that this was an issue and healthcare was a priority.
Going back to the early 90s when I first came here to the cities, there was no comfortable place outside of the community for people to go, so Indian Health Board was kind of it. At that time, if you were an American Indian person looking for culturally relevant health care.
Here at the Indian Health Board, the doctors and the nurse practitioners and mid-level providers, they're very dedicated. They've been here many years, and there's a sense of dedication to the patients that's long-standing. And this building, the services they offer, I feel it's very patient-oriented and always trying to find new services, things that they can do for the patients. So I feel it's a very functional, good place to work. I'm the kind of doctor, and the people I work with here are the same way, where you're not just taking care of their illness, you really have to figure out root causes of things and what their social needs are too, and at least, do more than offering just a listening ear sometimes. Go make some phone calls, figure out what could really help them.
As an urban program, we're totally supportive of our tribal partners. We're lockstep with them as far as the United States obligation to provide health care to our people.
If we had a woman today like Gloria come in and present the issues that she was struggling with, we could offer services to her children for after-school tutoring and cultural services. We could offer one-to-one counseling. We could offer traditional one-to-one counseling, traditional ceremonies. We could work with her to get her emergency assistance for her electrical.
Folks are now determining that where a person or a person lives and grows up has more effect on their health than actually going to the doctor or going, so in other words, where you grow up, where you live, where you play, all those things has a huge impact on sort of your well-being.
Little Earth of United Tribes housing and kind of the community makeup is really unique, and the biggest thing, the most important thing about this community, in my opinion, is that we are the only housing community in the nation that has Indian preference. I think what gets me most excited is the individual stories within this community and others.
I feel like I'm a very healthy person. Physically, I ride my bike, and I don't do it as a workout activity. I do it from point A to point B. I'll try to ride my bike. I started working out at Little Earth of United Tribes, and I feel like Minneapolis has really become my second community, my second home. As far as health goes, I'm really amazed with the opportunities that Native people have to live healthy lives, to even as far as healthcare goes, we have the IHB, we have the NAC clinic, but even as far as preventative efforts, we're at the health fair here, and you can tell there's so many different resources out there for Native people, young and old.
This is one of the special events in the community that I really appreciate attending. There's so much positive activities to partake in, and the children are just having a wonderful time. The adults get the chance to visit with one another and look into finding some really good resources that people will be able to utilize in the future. It was very positive, very beautiful and wonderful. So this is why I like to come here. We just see everybody and it's a fun time.
The philosophy that I bring to this job and the philosophy that, frankly, the team of staff that I've assembled here, the philosophy that we bring is, I think, different than most approaches in Indian country. Historically, the approaches in Indian country were always, we're in this place because of X, Y, and Z. It's historical trauma. Absolutely true. It has a huge impact today. It's the boarding school issues. That's true. The boarding school issues and what that did to Indian people is well documented. But I think historically leadership looked at these things and was always looking outward. The kind of the cause and effect, this happened, that's why we're here. The approach I bring is, yes, that happened, that's why we're here, but that's not going to change. Nothing, continuing to give power to that isn't going to help Indian people. So if we want tomorrow to be better than yesterday, then we got to get busy today. Let's put the work in today and let's make sure that we're making the decisions and we're doing the work to make tomorrow better.
We've created a half-mile corridor here called the American Indian Cultural Corridor. We've established the first 100% American Indian-owned bank in an urban area. We're sitting right here in an American Indian Fine Arts Gallery that's owned and operated by Indian people. We're next to a coffee shop that's Indian-owned. We have a number of murals. We have a number, just the list goes on and on.
I gain a lot personally from working here, and I think, and that's just shown by the many years that I've been here, that I provide a unique perspective to our board of directors, from me seeing patients one-on-one, and that's being translated into some policy, local policy, even a national policy. And it's always been coming back to the patients that I serve and the community I serve, and that striving to that ultimate goal as far as closing those health disparities down, getting our health care on par with the greater population around us. I think as Native people we deserve that. I think that we have a right to that. I feel very strongly that I'm fulfilling that mission. I'm fulfilling what the people that came before me and what they did and got us to a point. And hopefully there's a legacy that continues on as far as providing care for our people.
When a person walks in, it feels really good. If we can get all of our programs that way, when a Native walks in the door and they come in and they know this is the place I need to be. This is a place where they're going to help me. I'm going to get some help here. I'm going to get some care. I'm going to get better because I walked into this door. Just like you walk into a ceremony. In our old traditional ceremonies, you walk in or you go into the sweat lodge, you know it's just a nice healing place. It's just great to be there.